Hi everyone, welcome back to UWorld's Next Gen NCLEX Review. My name is Samantha, I am a nurse here at UWorld and I'm so excited to have you all back with us on Nurses Week. So today we're going to be covering developmental milestones, but super fun. We have a gifting extravaganza today. We're giving away 2 free 30-day UWorld subscriptions. We're going to have directions a little bit later for how to enter, but you can enter throughout the duration of the live. We'll be choosing our winners at the very end and announcing them before we're done here today. So I know we're coming up right on a graduation season. People are starting to study for that NCLEX. Go ahead and enter to win a free 30-day subscription, help you on your way to NCLEX success. So with that being said, today is a normal question drill. Otherwise, we're going to have Nurse Jackie moderating. Drop any comments, any questions you have into the chat, as well as, per usual, answers to today's questions. And if you haven't already, go follow us on whatever your preferred social media channel is. We will give preference for the winner to those who already follow us. Alrighty, so question 1. The nurse is assessing a 14-week-old client. Which of the following findings would be a priority to follow up? Option 1, blink reflex is present. 2, tear production occurs with crying. 3, eye gaze does not follow head movement. Or 4, can focus on an image 8 to 10 inches away from the eyes. Alrighty, I'm going to go ahead and jump into our chat. So go ahead and let us know. Alrighty, give me 1 second so I can see what you all are saying and thinking today. You guys have been doing so well this week, so I know we're going to be doing great today as well. Alrighty, and I see lots of option number 3s. Way to go, you guys. Seeing some great answers. Also, let us know where you are tuning in from. Who is a stateside viewer, who is an international viewer. Regardless of where you're joining from, we are so happy to have you. Alrighty, and April on YouTube says, are we just starting? We are. This is question number 1 of 7. And next up, we're going to explain our gifting for our 30-day subscription. So, April, you are just in time. Alrighty, it looks like you guys got it. Way to go. Option number 3 was our correct option. So our correct option again is that option number 3, eye gaze does not follow head movement. This is what's referred to as a doll's eye reflex, and it should have disappeared by this point. So if an infant's eyes are still lagging behind movement after 12 weeks, we start to worry about something going on neurologically, something that would connotate like a developmental deficit, and we would begin to worry. Therefore, we would have to follow it up and have some further intervention to assess this going forward. Option 1, 2, and 3 are all expected findings for a 14-week-old client, so we don't need to follow up because this is something we would expect at this developmental age. They should still have that blink reflex. We will see tear production occurring with crying, and they will be able to focus on an image that's just 8 to 10 inches away from their face. So great job, you guys. You all nailed that. Someone asked if I just did my hair. I did just do my hair. Thank you so much for noticing. Alrighty, so we are now going to explain our gifting session today. So we're giving away 2 free 30-day UWorld subscriptions. So we had a little trouble with it on Tuesday. I think some people were a little bit confused. So here's a slide that explains it. You're going to go to uworldnursing.com. Up top, you're going to see this very image that we have displayed with this wonderful nurse in the corner. This yellow subscribe button with the box around it. You're going to click there. You're going to press the yellow subscribe button. It will then pop up a form which looks exactly like this on the screen. Simply fill out the prompts, put in your email and your grad month and year, select that you're not a robot, which hopefully you're not, and then subscribe. That's all you need to do to submit. We're going to go through our submissions and choose our winners. Again, we're going to give preference to those who already follow us, but make sure you do this and subscribe. It's 2 simple steps, and that will enter you in to winning our free 30-day subscription. Also to note, if you have already entered into this, maybe a prior day this week, or we did this over the Christmas time as well, you can always enter again. You're still going to be considered. So if you've done it before, don't be deterred. You can do it again. Alrighty, super exciting. I'll leave it up for 1 more second, and then we'll jump back to our question drill, and we're going to be revealing our winners at the end of today's live. Alrighty, so question 2. The nurse is teaching the parent of a 3-year-old client about expected childhood growth and development milestones. Which of the following information should the nurse include? Select all that apply. So option 1 is parallel plays, 2 is ties shoelaces, 3 feeds self independently, 4 follows 3 consecutive commands, or lastly 5 speaks in 3 to 4 word sentences. Alrighty, go ahead and drop those answers in the chat, and also let us know who here is gearing up to take your NCLEX. Let us know so we can wish you good luck, and also let us know if you've passed it so we can congratulate you. That is so exciting. Again, I know my program, I think they graduated last week. May is prime time for a lot of our new spring graduates. They're really going to be gearing up to most likely take that NCLEX in the next couple of months. We're getting into a really heavy testing season. I see Rosie is taking hers on May 29th. Good luck. You're going to do amazing. Stay calm and be confident. Cassie on TikTok says she graduates next week. That's so exciting. Congratulations on all of your hard work. Alrighty, and so we'll give you a few more seconds, but again, we're heading into a big testing season, so make sure you are preparing yourself, making a plan, and investing in a test preparation platform. Again, it's always going to be quicker and much less expensive to pass it on the first try and invest in that test platform than it is to have to take it multiple times. Alrighty, and May 30th, good luck. I see a fingers crossed emoji. You got this. You're going to do great. Alrighty, so I see lots of answers in the chat, and it looks like, again, you guys are spot on. The bulk of the answers include 1, 3, and 5, and those are indeed our correct answers. So parallel, we're talking about 3-year-old client and their expected milestone. So parallel play as an option number 1 is the correct answer. This is something that should be included in the teaching because this is what we would expect by this age. So parallel play means a child is simply playing next to a child, but not necessarily playing together. They could be doing similar things. They could even mimic each other. They're still playing independently. They're just playing next to one another. And typically we see this happen by the age of 2. So a 3-year-old client should already be exhibiting this. Our next correct answer is 3, feed self independently. This is something we would expect to have happened by the age of 3. If it didn't develop yet, we would start to get a little bit concerned about developmental deficits. And lastly, 5, speaks in 3 to 4 word sentences. Also correct. We are going to expect a 3-year-old client to be able to string multiple words together to start forming some rudimentary sentences. 2 and 4 are incorrect. So 2 ties shoelaces. We're not going to expect a 3-year-old just 36 months of age to be able to tie their own shoelaces yet. And lastly, 4 follows 3 consecutive commands. Again, we're not expecting this by 3 years of age. 3 consecutive commands would be something like go inside, find your socks, and put on your shoes. That's a little bit too complex for a 3-year-old to be able to follow. We only expect to see this develop about by the age of 5. So at 3, we're not quite there yet. So 1, 3, and 5 were our correct answers. Way to go, you guys. Alrighty, question 3. We are moving and grooving today. Alrighty, so the nurse is teaching the parent of a 4-year-old client about nightmares. Which of the following information should the nurse include? So 1 is full awakening, typically follows a nightmare. 2 is children often have no memory of nightmares. 3 is allow the child to self-soothe before intervening. And 4, nightmares take place in the early hours of sleep. Alrighty. Keep letting us know. Drop those answers in the chat and keep following us. Someone is taking their exam on May the 14th and someone on June the 3rd. Good luck, you guys. Alrighty, June 21st, I also see. Way to go, everyone. Also, if you were part of the Tuesday Live and you won one of the 2 free subscriptions, or if you were on yesterday, the NSNA Live, we are still sending out emails. So if you haven't gotten it yet, do not worry. And I know yesterday we gave away 5 of the NSNA webinar tickets. If you won that on TikTok, please check your messages. We have sent a couple messages. We need you guys' emails. So make sure you check your messages if you won, for all of our TikTok viewers that won, because we're still waiting back on some of y'all's emails. So I think Barry was a winner. And then Juliana, I think, was another one, and Grace. So you guys check your messages and give us a response. That came from the UWorld Nurse TikTok account. Alrighty, so great job, you guys. A lot of answers coming in. I see more of a split. We have a lot of 3 and a lot of 1. Our correct answer was actually option number 1. So this one was a little tricky. We're talking about a 4-year-old client talking about nightmares. So in option 1, this is actually describing a nightmare. Full awakening will typically follow a nightmare. This is correct. A couple of points about nightmares. They are scary dreams. I'm sure we've all probably had nightmares, maybe about our NCLEX, maybe about nursing school exams, but they only take place during REM or REM sleep, and they're typically followed by a full awakening. Now, this differentiates them from something else called sleep terrors. Sleep terrors are being described in options 2, 3, and 4. That's why they were incorrect. Again, sleep terrors will typically occur during non-REM sleep, whereas nightmares occur during REM sleep, and the sleep terrors do not typically cause a full awakening. So 1 was correct because it denotes a nightmare. 2, 3, and 4 are more consistent with sleep terrors, which is not what the question was asking. Alrighty. Question number 4. The nurses taught the parent of a 13-year-old client about adolescent growth and development. Which of the following statements by the parent would indicate a correct understanding of the teaching? Select all that apply. So 1 is my child may experience a decline in self-esteem. 2, rapid growth is expected in early adolescence. 3, friendships with the same sex are more common. 4, my child will have a stable mood. And 5, full emotional detachment from the family is expected. Alrighty, keep those answers coming. We're talking about a 13-year-old client. So a lot of our developmental milestones that we previously covered were younger. They were 14-week-old, a 3 and a 4-year-old. Now we're talking about a 13-year-old. So we're a little bit further along, a little bit older here. Alrighty, keep letting us know. Keep dropping those answers in the chat. Thank you, thank you. I see lots of comments. We have lots of people coming up testing really soon. So best of luck. Lots of new graduates too. That's so exciting. Congratulations. Someone's saying we can't hear the mic. We are working on that now. Alrighty, and whenever you have issues with not being able to see the screen if it looks blurry, a good thing you can do is X out and come back in. Sometimes that'll help. A lot of times it has to do with the Wi-Fi, especially if you're watching on your phone. But thank you so much for bearing with us. We are working on this. If you continue to have issues, please keep letting us know so we can fix them. Alrighty, doing great, you guys. Lots of answers coming in. And again, you guys absolutely nailed this one. 1, 2, and 3 were our correct options here. So we're looking for correct understanding, meaning we're looking for those true statements. Option 1, 2, and 3 are true. So 1, my child may experience a decline in self-esteem. At 13, unfortunately, that self-esteem will start to decline. We don't usually see it rebound and increase again till that late adolescent period, which is between 18 and 20. So this indeed would be a true statement. Option 2, also true. Rapid growth is expected in early adolescence. 13 is consistent with that early adolescence period. I know if you think back to this age, when you were that age, this is when a lot of us were having growth spurts. So between that 11 to 14 age, we see a lot of this really, really rapid growth, or growth spurts as we often call them, until the child becomes physically mature around the age of 18 to 20, usually on the earlier side for girls and the later side for boys. Option 3, friendships with the same sex are more common, also true of a 13-year-old. So between 11 to 14, those same-sex friendships are going to take priority over relationships with the opposite sex that may have more of a romantic relationship, and that shifts to exploring relationships with the opposite sex more around 15 to 17 years of age. So at 13, we're still generally a little bit young for this. So 1, 2, and 3 were correct. I see that the sound is working now on Instagram. Thank you so much for letting us know. 4 and 5 were our incorrect options. So my child will have a stable mood. I don't know if you guys have spent a lot of time around 13-year-olds. That is definitely not true. Teenagers are going to have very unstable moods, especially at that early, preteen, early teen, 13 years of age. Lastly, full emotional detachment from the family is expected. This is incorrect. A 13-year-old is still very involved in the family unit. They're still living at home. We don't expect full emotional detachment until that late adolescence, being 18 to 20 years of age. At 13, they're still a little bit just too young for this. So 1, 2, and 3 were our correct options. Way to go, you guys. Alrighty, question 5. So the nurse is planning care for a 3-year-old client who is hospitalized. Which of the following interventions should the nurse include in the client's plan of care? Select all that apply. First is maintain the client's home routine as much as possible. 2 is demonstrate medical procedures to the client using a doll. 3 is ask the parent to bring the client a comfort item from home. 4, use medical terminology when describing procedures to the client. And 5, encourage the parent to remain with the client as much as possible. Drop those answers in the chat. Let us know what you all are thinking. We are still in the middle of our gifting session. We are giving away 2 free 30-day UWorld subscriptions today. We talked about being in such a heavy testing period, June and July. We see a lot of testers. Maybe some of y'all are on the early end of that, maybe like late May, but there is no better time to win a 30-day subscription than now. Again, we're giving away 2 for free today. So make sure you go to uworldnursing.com, hit that yellow subscribe button up top. You'll then be prompted to give your email as well as your graduation month and year. Simply fill those forms in, press subscribe, and you will be done. We're going to go ahead and look at everyone that submits that in the course of today's live and pick from that pool of entries. So it's not too late. We haven't chosen our winners yet. Please keep doing that, and we will reveal our lucky winners at the end of today's question drill. Alrighty. Oh, and Nursing Coley says hi. Hi, Nursing Coley. We miss you. Alrighty. So keep dropping those answers in the chat, and we will go ahead and reveal our answers. And those are going to be 1, 2, 3, and 5. So 1 is a correct option, maintain the client's home routine as much as possible. It's important for these clients to maintain a sense of normalcy, especially in this young age demographic. So if, for instance, this client prefers to bathe before they go to bed, we would want to make sure we keep that same schedule. Also, if they maybe brush their teeth before they take their morning medications, to the best of our ability, we want to make sure that we honor those and try and keep that home routine as much as possible, just to maintain that sense of normalcy. Option 2, also correct. Demonstrate medical procedures to the client using a doll. This helps a pediatric client, again, they're only 3 years old, to understand what's going on. It puts them into understandable terms, and a doll is something that it's going to make it link to the child's brain a little bit easier, make it more simple to understand. Option 3, ask the parent to bring the client a comfort item from home. Also true. We should allow these pediatric clients to keep a stuffed animal, a blanket, a toy that brings them comfort. They're in a foreign environment, being a hospital, they can be scary. So bringing a comfort item is something that can help these clients out. Our last correct option was 5, encourage the parent to remain with the client as much as possible. Our 3-year-old clients are still going to get a lot of comfort, a lot of safety from their parents and their caregivers. So we should indeed encourage them to stay with the client as much as possible. Not only does this provide that comfort, it also provides a sense of normalcy. And lastly, our only incorrect option was 4, use medical terminology when describing procedures to the client. This is incorrect. A 3-year-old client will simply not be able to understand this. A lot of adult clients are not able to understand medical terminology and medical jargon, but these 3-year-old clients will already have such a limited understanding of what's going on. If we throw a bunch of big fancy words in there, we're going to lose them. They're not going to understand what's happening. Also important is we want to explain things multiple times to these pediatric clients. We can describe it, a day or 2 before it happens. We also want to describe it immediately before it happens, because these young clients don't have a great sense of time. They don't have a reliable memory at this point. So we need to make sure we explain it beforehand, prepare them, as well as right before, so they understand that what is happening and that it's happening right now. All right, so 1, 2, 3, and 5 were our correct options. Way to go, you guys. All righty, question 6 of 7. We're getting closer to the end, closer to revealing our winners. So if you haven't submitted yet, go ahead and do that now. But here the nurse is screening pediatric clients for autism spectrum disorder. It would require follow-up if a 9-month-old client has not developed a strong pincer grasp. Would it require follow-up if a 17-month-old client cannot kick a ball? A 24-month-old client lacks spontaneous eye contact, or lastly, a 36-month-old client cannot hop on 1 foot. Drop those answers in the chat and let us know what you all are thinking. All righty. And keep letting us know what topics you all want to see us do. So this is Nurses Week. I hope you guys are celebrating as such, celebrating responsibly, but we are hitting our 5 most requested topics, being OB, peds, which is today, mental health, pharmacology, and cardio. So those are our 5 most heavily requested topics. We really tried to hit those high points or pain points, I guess we could call them, for their NCLEX studying. So we're hitting all of those 5 this week. We're doing new question drills for every live. We're so excited about it, but keep letting us know maybe we didn't cover something that you wanted to see. Maybe there's a certain topic that's a pain point for you that you really struggle with. Let us know and we'll work it into our content calendar. I see renal, I see med surg. Those are great recommendations. I want to say we have a GU one coming up, but you can always check uworldnursing.com, and that will give you our full schedule of events, the times, the channels that we are going to be going live, and of course the topics that we're going to present. Someone's asking for electrolytes and ABGs. We just covered that last week. I feel like such in depth, but we will put it back up. Someone asked, we have one today, this afternoon. We do have one this afternoon with Nurse Jackie at 3 p.m. Central Time, and that's going to be an ECG strip question drill. So again, another really, really heavily requested topic. Alrighty, med surg and pharm, principles of nursing. Someone says, are the questions at the same time every day? They are not. Go to uworldnursing.com for our full schedule. We're kind of all over the board. We're trying to offer a bigger variety of times because we know you guys all have such different schedules. We just started offering evening lives, so go to uworldnursing.com again to make sure you see our full schedule and the times that we're going to be going live. Alrighty, so lots of great recommendations. Thank you so much. And I see lots of answers as well and almost all correct answers. So good job, you guys. Our correct option was option number 3. So this one we're going to need to follow up. This needs further intervention because it's a concerning finding. Spontaneous eye contact is something that should have already developed by 24 months or 2 years of age, meaning if it's not there, this is a sign of a potential developmental deficit. So it would require follow-up for a screen for potential autism spectrum disorder in this case. 1, 2, and 4 do not require follow-up because these are not causes for concern. So option number 1, this 9-month-old client has not developed a strong pincer grasp. That fine pincer grasp usually develops around 12 months. So if this 9-month-old client just isn't quite there yet, it's not a cause for concern. We're not going to need to follow up this in the here and now. Option 2, 17-month-old client cannot kick a ball. This is a skill that usually develops around 24 months or 2 years of age. So at 17 months, if they haven't mastered this, again, not a cause for concern. We would not need to follow up. And lastly, 4, 36-month-old client cannot hop on 1 foot. Typically, this is going to happen around the age of 5. So 36 months, they're only 3 years of age. We're not concerned if a client is not able to hop on 1 foot. Alrighty, great job, you guys. And someone asked us to cover ECG strips. They're really confusing. We're going to be covering them at 3 p.m. this afternoon, Central Time. Alrighty, last question before we reveal our winners. So here, the nurse is assessing a 2-year-old client. Which of the following findings would require follow-up? 1 is walks with assistance. 2 is identifies 2 body parts. 3 uses a spoon during meals. 4 speaks in 2-word phrases. Already dropped those answers in the chat. Also, let us know after we're done how many out of 7 you all got correct today. But I saw a lot of great answers, so I know you all did so well. And don't forget to visit uworldnursing.com. Also, this is your last chance to enter into our gifting session for 2 free UWorld 30-day subscriptions. We're going to be revealing our winners. We're working on them right now after this final question. So excited to reveal that. Also, anyone that has won in the past and is waiting for your email, make sure you have checked all of your TikTok, Instagram, whatever you're joining on, check your messages too, so we can make sure we get your email because that's what we're going to need. Alrighty, lots of great answers. Great job today, and you all are spot on. Option number 1 was our correct option. So here, walks with assistance is what's going to require follow-up. It means we're concerned about this finding. So By the age of 2, this client should be walking independently and not with assistance. So they should not be holding on to a caregiver or a couch or a chair, what's called cruising. They should be able to walk independently. We would want to follow this through, make sure there's no developmental deficit, nothing going on neurologically or musculoskeletally. So this would be our cause for concern. Options 2, 3, and 4 are expected findings in a 2-year-old client. Therefore, we would not need to follow them up. We would not need to further screen this client. So option 1 was our correct option. Way to go, you guys. And now it is time to reveal our winners. So we have Wendy N and Yasira O. So Wendy and Yasira, congratulations. You have won each of you have won a free 30-day UWorld subscription. Make sure you join us again at 3 p.m. Central Standard Time today. We're going to be giving away 2 more free subscriptions. So if you didn't win now, come back and join us and you'll be entered in again to win that time. So thank you again for joining. Happy Nurses Week. And